Hi Hyper Athletes, I'm Dr. Lisa Erickson, and today we're going to discuss the lower back and the issue that we have between hip flexibility and lower back pain. Often I see patients coming in with lower back pain, and we'll poke around and we'll do some examination procedures, and we won't actually be able to find a local cause as to why that patient has low back pain. They might have swelling and inflammation and muscular soreness, but there may not be a joint locked up or an issue in their low back that's giving them low back pain. The majority of my athletes, be it my cyclists who are spring cyclists, and they've been doing lots of hills and lots of high tempo, high cadence riding aggressively up sharp angled surfaces, they will have more hip flexor tightness, more front of the hip contracture that can give them low back pain. My ski mountaineers who do lots of skiing up ski areas that are very steep, or up 14ers to where the front of their hip and the front of their thigh start to get issues. And also my climbers who are on the wall and they're doing some crazy dyno moves and yanking that hip up as quickly as they can, they will also get hip issues. And so today we're going to talk a little bit about the correlation between those hip issues and why they have low back pain. So the way that the hip works is the muscles of our hip flexors. We have two muscles that are major hip flexors. We have our psoas, which attaches on the inside of the femur, comes up through the pelvic girdle, and attaches right where your belly button is on the back of the spine. That is the psoas muscle, and it is responsible for lifting the hip up. There's also a muscle called the iliacus, and it attaches on the inside of the hip bowl. So if this is your ilium, it attaches on the inside of the ilium, becomes a muscle, and that muscle belly wraps around and also attaches down on the inside of the femur. So if both of those are tight, you might feel some ropiness, some snapping in there, but they can give you lots of issues. So this little tiny space on the front of the hip, there's not that much space for the different structures to pass through. So if you're having snapping, soreness, or if the muscle, even the muscle of the quad is very tight, and that muscle comes up, becomes a tendon, and attaches up in here, that also can give you a very tight tendon, and when that muscle's pulling very tightly on that tendon will actually swell in size. And so if your iliacus is tight, or your psoas muscle, the one that attaches on the top of your low back, bottom two ribs is tight, those tendons will swell from the constant tugging, and you can have a lot of friction and snapping on the front of the hip. So, but back to our issue about low back pain is that when the front of the hip is tight and you can't take your hip and extend it past neutral, instead of the front of the hip extending, what we start to notice is we come to a point where it locks out, and then that poor athlete starts to either overextend their low back or they start to rotate their pelvis. So I will see a lot of that in my patients that have very tight hips on the front. The body has to compensate in some way, so it's either going to compensate by having that pelvis twist to make motion where the hip flexor cannot, all types of different things. So as for low back pain, the muscle of the psoas attaches on the very bottom two ribs. And so if I were to drop a hole in my belly button and drop that finger all the way to the back, it is pretty much right up just at the very base of where this curve changes. So the thoracic spine curves one way, the lumbar spine curves another way, and right in the center is where that psoas attaches. So if you were on the bike and you're really working that deep hip flexor, lifting that knee up and driving up the hill by pedaling, that is really going to contract that muscle. And when that psoas muscle gets tight, it will pull that low back into more of an arc and lock up your low back. So with that said, let's talk about a couple stretches we can do for our psoas and for our iliacus muscle, and also some other homework exercises we can work on. So my favorite one is kneeling in relaxation. When we're standing, we tend not to be able to get these muscles to relax as well as if we are kneeling. So I want you to go ahead and hop on a knee. If this is sore, I want you to put a pad underneath it. I have one somewhere around here. So on the knee, and then we are gently just pushing that pelvis forwards. I don't want your hips to be rotating or twisting, so look down and make sure that they are level and symmetrical, and then make sure that you are very, very gently pushing to end range. And when you feel it start to become tight or sore, just hold that posture. Very common mistake is athletes trying to push this way or athletes will really hyperextend and lean forward. Yeah, I can come a long way that way, but that's not our goal. Our goal is to stand up as straight as possible, and as if we have a rope around the back of our hips, just pushing it forwards and almost up. Stretching out to the front of the hip. You should feel all the way down into the front of the thigh. Okay? That is the psoas muscle and also part of the quad if your quads are really tight. Secondarily is the iliacus muscle on the inside of this hip. And to stretch that guy out, it's the exact same stretch as the quad stretch. So I'm stretching towards you. The only difference is that I am going to take my back foot and bring it across center a little bit. So if I were to look back maybe 15, 30 degrees across center, that's about it. And then we're just gently, the exact same thing, pushing the hips forward and feeling a nice stretch up the front of the hip. And it might be a little bit higher up in here, and that's kind of what we're going for. Iliacus. I want you to do it on both sides, okay? One side you're going to be tighter in one area and not the other. Our third stretch is front of the quad, and you can stick some pillows underneath your knees if you need to. But our biggest goal is to hang from the edge of your bed by your foot, and then we're just relaxing onto our heel. You'll feel a nice deep quad stretch down the front. And we're just going to hold that nice and gently, letting pain be your guide, and you should just be able to relax into that stretch. The more pillows you put underneath your knee, the more you can relax into that stretch, the longer you can hold that stretch. So some of these, maybe 30 seconds to a minute. If you can relax into that stretch for a longer period of time, then let's start to say perhaps 3 to 4 minutes. The last one is a deep pigeon pose, which most athletes know, but again, it's for the front of the hips. And we are trying to get into this square hip pose. I'm a runner, I'm a cyclist, I'm a climber, I'm not as flexible. So if you watch a yoga guru do this, they're all the way down onto the floor. So from the side, hip behind you, knee behind you, our hips should be symmetrical. One shouldn't be in front of the other. And then if you're super flexible, you can get that all the way out to a 90-degree angle. And then if you need to put a block underneath this hip to rest it on, stick it right underneath, right under this side, and just gently rest onto it. And these ones we can hold for up to 4 minutes, okay? So those are pretty darn good stretches. Let's go into the soft tissue part of it. That'd be my favorite toy. These little tiny balls, you can use a TP quad ball or ball. You can use a lacrosse ball. You can use a baseball. Anything that is round. The really knobby ones might be a little too aggressive because what we're going to do is start working on our psoas from the front. So our psoas muscle, again, attaches on the spine where our belly button is. It comes down towards the hip. So when you lay into what we call coke pose, we're going to modify it and just rest on our elbows. Your abs push out to the front. So does your psoas. And all of your organs are far away from the surface. Pardon me. So if we're going to do some work on the muscles in the front of our spine, you shouldn't have to worry about piercing a colon or damaging an organ because those are all deeper within our body. So just picking something soft and squishy, you can get down into those areas. So I will pick right where my belly button is and slowly trace out towards the hip. So we'll start in there. Just lay it kind of right where your belly button is on the side, and we're just going to gently rock our hips side to side until we find a little bit tighter of a spot. And then when you find a tight spot that might be a little sore, a little achy, we're just going to relax on that spot and forget the ball is there. So if you sit on that spot, at first it's going to tell you it's very unhappy and things are maybe getting a little more painful. But if you can relax and breathe through it, those muscles should start to slowly elongate out to neutral, and then you don't have pain there anymore. So my basic rule of thumb is doing some gentle rhythmic breathing that should help it to relax. If it does not relax and it starts to get worse, wait for it for 30-40 seconds, and if it still continues to get worse, then call your local doc and make sure you're doing it right. So as for the breathing, usually I will tell patients to breathe into that knot. Nice breath into that knot, so we're bringing in blood flow, we're breathing in nutrition, and we're letting go of all the waste. So every cell needs food, every cell has waste. So on the inhale, we're inhaling all these nutrients into it, and we're also focusing our mind on that spot to train mind-body control into getting these knots to let go faster and faster they let go every time you work on them. It's just training that muscle that when I push on it, it's supposed to respond. And a lot of times as an athlete, we teach these muscles to suffer a lot without any benefit. So they don't really learn to talk to us. I'm sore, I'm achy, I need water, you're pushing me too hard, because we just ignore them. So therefore it becomes very hard to do your own body work and to have these happy, healthy muscles that work with us when we're always fighting with them. So on the inhale, we're breathing nutrients, we're breathing blood flow and oxygen into that spot. On the exhale, I want you to focus on completely relaxing into the floor and letting go of any carried stress in that area and perhaps elsewhere, such as your butt cheeks, your hamstrings, your toes, your face, even the skin on your face, just relaxing all of that. So when that knot is gone and just melts and disappears, you don't feel it anymore, then you can move that ball to a new location, roll back onto it. It might feel sore and tight, and then we start from scratch. So don't do this every day. You can do it up to, I'd say, every third day or so. The biggest thing is it's just like weightlifting. So whenever you're working on these things, it's very important to make sure that they also have adequate rest. So every time you use a muscle, that muscle needs to rest, it needs to heal, and pushing it way too hard with balls and Theracanes and that type of stuff is the biggest mistake I see in patients who are really working hard to heal. So inflammation control, getting that pain under control, getting that tissue flexible, and then we start rehabbing. Okay, so that's a little bit on back flexibility and how it ties into our deep hip flexors in the front of the hip. So go work on those and we'll talk again soon. Have a great day.